Assalamu alaikum. I am Dr. Noreen and starting the lecture on cardiac failure treatment. Yesterday we have completed the digoxin, which increased the contractility of the heart. Today we have started from the beta-adrenergic receptor stimulants. Beta-adrenergic receptor stimulants, they causes increase in the contraction of the heart by stimulating the beta-1 agonist, dopamine. The mechanism of action of dopamine is it increases the cyclic AMP and resulting in the activation of protein kinase. Means this is enzyme linked. Protein kinase phosphorylate the calcium channels. When there is the phosphorylation of the calcium channels, there is increased entry of the calcium ions into the cells, and when there is increase in calcium, there is contraction of the cardiac muscles, which results in the positive inotropic effect. The route of administration of dopamine is intravenous route of administration. Then the dopamine, as I have told you, this is positive inotropic, means by increasing the calcium concentration inside the cell, it causes the contraction of the myocardium. So strength of the heart to contract is increased. Along with this, it also causes the vasodilation, means they decrease the afterload. So increase in cardiac output along with the decrease in ventricular filling pressure, it improves the heart contractility. As we have seen, the tachycardia in case of digoxin, but in this case, tachycardia and increase in myocardial consumption also been reported. Dopamine is used in acute heart failure, and particularly it is also useful in need to raise the blood pressure. Means when there is the heart failure due to the hypovolemia, the dopamine is given to increase the contractility along with increase the resistance in the peripheral vascular system. So when contraction of the vessels muscle, it leads to increased flow towards the heart. Then the third group, Bipyridines. This is also increase the heart rate, heart contraction. They are inamerinon and milirinon. These drugs increase the inward calcium influx in the heart. Increased calcium influx in the heart resultant by the movement of calcium from the sarcoplasmic reticulum. The mechanism of action of bipyridines, they inhibit phosphodiesterase 3. Again, they causes increased intracellular concentration of the cyclic AMP, and when there is increased cyclic AMP, they causes increased concentration of calcium inside the myocardium. And when there is increased calcium, it results in the increased cardiac contractility. You people knows the walk long theory. When there is increased calcium, it causes the movement of the actin and the myosin and resultant in the increased contractility. Along with increased contractility, it also causes the vasodilatation. The pharmacokinetic of bipyrimidine, they are active orally as well as parenterally. Elimination means half-life is 3 to 6 hours and route of excretion is the kidneys. And these are the drugs are useful in the acute cardiac failure. If there is the toxicity of bipyridines, what are the signs and symptoms a doctor can observe? They are nausea, vomiting, arrhythmias, and changes in the liver enzymes, and thrombocytopenia. Means if there is a toxicity of bipyrimidine, they can result in these signs and symptoms. Up to this, we have discussed the drugs which have positive chronotropic effects. Means they causes increased influx of the calcium and resultant in the increased contraction of the myocardium. Because heart failure means there is decreased contractility. The basic function of the heart is to contract and eject the blood or to relax to receive the blood. If there is no contractility, then there is the failure of the heart. And if heart fails, the oxygen requirement to the body tissue increases. So up to this, we have discussing the positive chronotropic drugs. Now we have discussing the drugs which without positive inotropic effects. Means these drugs doesn't cause increased contractility of the heart muscles, but they reduce either the preload or the afterload. 70% of heart failure is caused due to the cardiomyopathies and atherosclerosis. So we have to give the drugs which decreases the pressure which heart can face, either preload or the afterload. So these drugs which decreases the preload or afterload. They are categorized as number 1, diuretics, number 2, the AC inhibitors, number 3, the beta blockers, and vasodilators. Understand? Can you hear me? Hello? Hello? Heart failure can be treated by giving the drugs which are called diuretics, or these drugs are called water lovers. They are thiazide diuretics, furosemides, and the spironolactone. Reduce venous pressure. When it reduces the venous pressure, means they reduces the right side ventricular preload. And when there is reduction in the right ventricular preload, it will reduce the edema, the cardiac size, and also improves the pumping ability. Spironolactone, an aldosterone antagonist, has additional benefit because aldosterone is the hormone which to some extent have the ability to causes myocardial and vascular fibrosis. So spironolactone on one side, if decreases the volume, also decreases the chances of myocardial and vascular fibrosis. So we can give these diuretics to reduce the preload. This is the picture which shows the nephron structure, in which there is the loop of Henle, there is the collecting tubule, and action of the drugs which are called diuretics on different parts of the nephron. Thiazide inhibit active exchange of chloride and sodium in the cortical portion of the diuretic ascending loop of Henle. And potassium sparing diuretic inhibit reabsorption of sodium in the distal convoluted tubule and collecting tubule. Thiazide act on the ascending loop of Henle, potassium sparing act on the convoluted tubule and collecting ducts. And loop diuretics, they inhibit the exchange of chloride, sodium, and potassium in the thick segment of the ascending loop of Henle. And these sites results in the excessive fluid and sodium excretion from the body, and body gets rid from the extra volume of the fluid and electrolytes. Now, can you hear me? Students, the next group of the drug is renin angiotensin system blockers. As you all know, these are the drugs which are used in the hypertension to decrease the blood pressure. And increased in blood pressure increases the afterload against which the heart contracts. Our aim is to decrease the contraction against high pressure. AC inhibitors, they are captopril, enalapril, fosinopril, lisinopril, hunapril, and ramipril. They are angiotensin converting enzyme inhibitors, and they are used to decrease the systolic or diastolic blood pressure. The second group is angiotensin receptor blockers. They are enzyme blockers, and the second one is the receptor blockers. They are losartan, valsartan, candesartan, ipurosartan, ibisartan, and telmisartan. Renin angiotensin blockers reduces the peripheral vascular resistance, so they reduce the afterload. Reduce salt and water retention by reducing the aldosterone by reduces the preload. Means one aspect that it reduces the peripheral resistance, and the other effect it reduces the aldosterone, which is results in decreased peripheral resistance. Third effect of angiotensin system blockers, they also reduces the norepinephrine release. So first, they decreases the peripheral resistance. Second, they decrease the aldosterone. Third one is that decreases the norepinephrine release. So these drugs are used for long-term therapy of the heart failure. There are three sites where these drugs act. They decrease the pressure, they decrease the aldosterone secretion, they decrease the norepinephrine release, which ultimately results in the vasoconstriction. But when they are decreased, there is the peripheral resistance goes down. Renin angiotensin system blockers. Renin angio system blockers, they are omylopetrilate. This is the new class. AC inhibitors and enzyme inhibitors. They are previously practiced, but now there is another group belonging to the same system, that is the renin angiotensin system. And this drug inhibit both AC angiotensin converting enzyme and neural endopeptidase. Neural endopeptidase is an enzyme that inactivate bradykinin and nitrouresis. If it will blocks, so there is increased concentration of bradykinin, which is a vasodilator, and natriuretic peptides. So they decrease the peripheral vascular resistance. Can you hear me? Hello? It increases exercise tolerance and to reduce morbidity and mortality. First is the diuretics, and second one is the renin angiotensin system blockers. In renin angiotensin system blockers, we have studied enzyme blockers, then there is the renin angiotensin converting enzyme inhibitors, and angiotensin receptor blockers. The third categorization is the drug which block both angiotensin converting enzyme along with this neutral endopeptidase. So these drugs increases the exercise tolerance and reduce the morbidity and the mortality. Another drug is the aspirin, renin inhibitor. Now there are the third group of the drugs which is used in the heart failure. They are called vasodilators. Hydralazine, isosorbide dinitrate, and sodium nitroprusides. These drugs are called vasodilators, and they reduce the preload through venodilatation and they reduce the afterload through arteriolar dilatation. Long-term use of hydralazine and isosorbide dinitrate can reduce damaging remodeling of the heart. These are also vasodilators. Combined therapy of hydralazine and isosorbide dinitrate. As you all know, hydralazine is a vasodilator and isosorbide dinitrate are the coronary vasodilators. And these drugs are prescribed when there is any issue to AC inhibitors. Nasitrite. This is a synthetic form of endogenous peptide and brain natriuretic peptide. And these are the drugs which are recently बेटे आपने कहाँ तक का लेक्चर सुना है? हेलो, जी बेटा. The next class is the beta blockers. Beta blockers are the drugs which causes the inhibition of the beta receptors, and by inhibiting the beta receptors, it decreases the resistance in the peripheral vessels. The drugs are bisoprolol, carvedilol, and metoprolol. These are the drugs which are termed as beta blockers, and they causes the decrease in the peripheral resistance. When there is decrease in peripheral resistance, so heart is not at pressure. So there is the reduction in the mortality and morbidity in the severe heart failures. These drugs, these are the main drugs for decreasing the hypertension, and as I have already told you, the hypertension is the major cause of heart failure. So by reducing the hypertension, we can reduce the workload on the heart. Now we have summarized the lecture, the drugs commonly used in acute heart failure. These are the diuretics, and in diuretics we have loop diuretic, thiazide diuretics, and spironolactones, that is the potassium sparing diuretics. And also the drugs which causes the dilatation of the vessels, they are termed as vasodilators. They are commonly used in acute heart failure. The drugs which are used in chronic heart failure, they are diuretics, means the water lovers, the cardiac glycosides, AC inhibitors, and the beta blockers. In these drugs, the cardiac glycosides, they are positive chronotropic drugs, and diuretics, AC inhibitors, and the beta blockers. These are the drugs which reduces the resistance along with the volume overload. How to manage the patients who is suffered from chronic heart failure? First, aim is to reduce the workload on the heart. And how can we reduce the workload? There will be the limitation in the activity of the patient. There should be reduction in the weight, and there should be controlled hypertension, because hypertension is the major cause of cardiac failure. Major steps for the management of chronic heart failure. You should remove the sodium from your body by dietary salt restriction, by causing the diuresis. Diuresis should be started with thiazide diuretics and may be up to the loop diuretics. Sodium loss causes the secondary loss of the potassium, which is hazardous if patient is to be given digitalis. Means you should be careful the patients who are taking the digitalis. So salt restriction is the first step in the management of chronic heart failure. Then the AC inhibitors. AC inhibitors have multifactorial mechanism of action. They causes the reduction in the peripheral resistance. They decrease the release of aldosterone. They decrease the norepinephrine release. So they decrease the peripheral resistance. So AC inhibitors, because of these mechanism of actions, is superior than the vasodilators. So they should be used as first line therapy for chronic heart failure patients. Then the vasodilators, they are also given to the patients who are suffered from chronic heart failures. Patient presenting with dyspnea. Dyspnea is the symptoms of the heart failure due to the excessive fluid congestion in the alveoli. So it should be treated with venous dilators, nitrates, and the AC inhibitors. So there is reduction in the pressure both in systemic as well as in pulmonary system. The patients who are complaining of fatigue, means excessive uneasiness due to left ventricular output. In these cases, the patient should receive the arterial dilator, and this is useful for decreasing the forward cardiac output. If patients involving both elevated pressure and decreased cardiac output, so in these cases, you should give the vasodilators, the coronary vasodilators, and also digitalis and diuretic therapy. AC inhibitors along with diuretics are useful as first line therapy. Major steps in the management of acute heart failure. Acute heart failure occurs frequently in patients with cardiac heart failure. It is usually associated with increased exertion, emotions, increase intake of sodium, and the patients who are not compliant to the medical therapy. And sometimes there is increased metabolic demand like fever, anemia, pregnancy, beriberi, and these are the condition in which there is acute heart failure experienced by the patients who are suffered from the chronic heart failure. Conventional treatment of acute heart failure, you should reduce the fluid volume, you should decrease the preload, and augment the contractility of the heart. Means all the drugs who have the positive chronotropic effect and the drugs which don't have the positive inotropic effect. You improve the contractility, and along with this, you decrease the preload and the afterload. Therapeutic classification of subsets in acute myocardial infarction. Hypovolemia, you should give fluid replacement. Means a patient who is suffering from excessive loss of water and salt from your body. So there is decreased blood volume towards the heart. You should give volume replacement. When there is pulmonary congestion, you should give the diuretics. Peripheral vasodilators, you should give the peripheral vasodilatation by the vasodilators. If there is a failure of the power, means the function of the heart. क्या कह रहे बेटा? Hello? If there is the loss of contractility of the myocardium, you should give positive inotropic drugs. And which are the positive inotropic drugs? They are the digoxin. There is the Bipyridines. These are the drugs which increase the power of the heart. In severe shock, should give circulatory assistance. If there is the ventricular failure, you have to give in ventricular infarct, you should give the drugs which increase the oxygenation of the blood. So there are different ways how to give the therapy to the patients in acute myocardial infarction leading to the heart failure. Along with the pharmacological treatment, we have another option, that is the surgical option. You biventricular pacemaker placings. Hello? Any question? बेटा आप मुझे सुन रहे हैं? Hello? Any question about the topic heart failure? You can ask. Ada? Please place your question. आवाज नहीं आ रही मुझे। क्वेश्चन पूछे कोई तो पूछे। Okay. Myocardial aldosterone side effect is to cause the myocardial fibrosis, means excessive fibrosis generation. This is the side effect. Okay. But a positive inotropic means the drugs which increase the heart rate, and positive chronotropic are the drugs which increases the force of contraction of the heart. And in heart failure, we facing the problem that heart is unable to pump the blood properly. So when you are given the drugs which are positive chronotropic, they increases the strength of contraction. Hello? Hello? Fibrosis is the side effect. The mechanism, exactly what is the mechanism is not clear. The dyspnea in the heart failure is due to the overcongestion of the pulmonary tree. So there is decreased oxygenation, and when their oxygenation of the blood is less, patient feel dyspnea. Not sodium, but the aldosterone, the hormone aldosterone is responsible for the fibrosis, not the sodium. Understand? Okay. Power failure means the strength of the cardiac muscles, myocardium. The strength with which the heart contracts is called power of the heart, and when inability to contract properly, this is called the power failure. Understand? Spironolactone is the potassium sparing diuretic, means this is the diuretic, decreases the fluid, and digitalis is the positive chronotropic drug which increases the strength of heart muscles. So there is the relation. If digitalis is given to the patient, it increases the force of contraction, and when you are given the diuretic spironolactone, it decreases the peripheral vascular resistance. So there is the improvement in the patient's condition. we have lot of option of the drugs, various groups which are used for the patients of heart failure. So if there is fibrosis, so you should stop the aldosterone, potassium sparing diuretics. Understand? Hello? Any other question? So इसको close करें. Okay, classes. आप ये बताएं मुझे कैसे आपको पता चले आप पेशेंट को समझ रहे हैं नहीं समझ रहे हैं. एक क्वेश्चन पैटर्न देंगे फाइब्रोसिस फाइब्रोसिस साइड इफेक्ट क्यों हो रहा है कैसे. अब आप सामने हो तो बंदा आपको समझाएगा. हो गया तो खादा चम्मच कीजिएगा शायद किसने डॉक्टर नोरीन मैं